So as I was talking about the gastrointestinal related disorders, so that is antacids, you can say. So during indigestion, digestions, vomiting, emesis, antiemetics for constipation, laxative and cathartics, diarrheals for diarrhea, antidiarrheal and other disorders. Most of the gastrointestinal tract disorders they are related with mortality. Non-specific treatment of GIT disorders may be useful by the correction of fluids and electrolyte balance, diet modification, provision of nutritional support, alleviation of pain. Drug uses and effect of the gastrointestinal tract, so that is drug related to vomiting, drugs used in peptic ulcer reduce the acid secretion, drugs used in diarrhea, drugs used in constipation, drugs used in antiflatulant, drugs used in antispasmodic, and drugs used in appetite stimulants, and drugs used in indigestion. So all these are the drugs which are used in gastrointestinal disorder. So the first one is antiemetics and emetic drugs. First of all, vomitings, vomiting is the ejecting of the matter from the stomach through the mouth, and nausea is a feeling of sickness with an inclination to the vomit. There are certain causes of vomiting, that is food intolerance, pregnancy, surgery, viral and bacterial infection. So due to certain drugs such as antibiotics, antineoplastics or chemotherapeutic agents or radiation therapy. Nausea and vomiting to expel out the toxic material. So vomiting center middle of longata, so this is the main centers where the sensory signals from the gastrointestinal tracts and then inner ear, while the chemoreceptor trigger zone CTZ. Antiemetic classification, so anticholinergics, H1 antihistamine, neuroleptic drugs, dopamine antagonist, prokinetic drugs, serotonin receptor antagonist, 5-HT antagonist, adjuvant antiemetics, and substances P neurokinins, 1 receptor blockers. Inshallah, in my next lecture, we will talk about the antiemetics. What are antiemetics?